Hey, Jim, have you ever wondered what the FDA is up to?
What are they doing over there?
What are they doing? They're like food dye, PFAS, cold medicine.
Yeah.
Yeah.
It's like what don't they administrate?
Yeah, isn't everything a food or drug? So listen, one of our listeners messaged us on Instagram and asked about that. They asked, I'll read the whole message in a little bit, but they asked, how can I trust or verify that products that get approved are really what they seem to be? And we are going to do a deep dive, a two-parter
Okay.
on the FDA. Can I trust them? We're going to talk about food dye, thalidomide, and revisit cold medicine. Can we trust the FDA? Yes or no?
Okay.
Are you ready?
Mm-hmm.
Let's do it.
Let's do it.
Hey, I'm Melissa.
I'm Jam.
And I'm a chemist.
And I'm not.
And welcome to Chemistry for Your Life.
The podcast helps you understand the chemistry of your everyday life.
Okay, so I know we just did, it was unplanned for us to do our little chat about funding.
Right.
This episode was already planned. And so usually I don't do too many non-chemistry episodes in a row, but we're going to have a few that are like foundations in science without being actual science lessons.
Okay.
It's like we're doing like a little history of chemistry type.
Okay.
Or like political implications of chemistry sort of thing.
And in the case of FDA, it's like, the one we just did about funding is such a recent like topic or whatever.
Mm-hmm.
But FDA is like, that comes up all the time in so many episodes
all
we talked
the
about.
time.
So
yeah.
it's not really like recent. It's like a kind of every episode has probably had its references to the FDA.
Oh, absolutely.
So
this message came to us, a thing that inspired this episode. I'd been thinking about it actually. I also had a request from one of my students, but it came from a message on Instagram. Someone, it was Castle on Instagram, said, I'm reaching out in search of the truth and hoping you guys are willing and able. I recently read a book called Merchants of Doubt. This is from them. I have not read this. I don't even know what it's about. And to avoid the complicated controversy of what's true or not, I just wanted to ask for your personal opinions on chemists and their relationship with organizations like the FDA. I am not a chemist. How can I trust or verify what products that get approved are actually what they seem to be? And then they said, again, love your content. Keep sharing your knowledge. So that was nice. With 3 exclamation points and a smiley face. So I was like, you know what? That's a really good question. And it brought to mind a conversation that I had with my students after the election. We talked about what is the relationship between chemistry and the government or science and the government. And they're really intertwined. And one of the ways that the students pointed out, I kind of let them talk about how do you think they're interrelated, is that the government has a lot of control on how science then impacts society. And one of those ways is through the FDA.
Okay.
It's like, okay, we have this research and the FDA is sort of a governing body that gets to decide things about, okay, do people get to use this or not?
Got it.
And one that we've talked about a lot is cold medicine. And there's a cold medicine that doesn't really work.
Yeah.
There's Sudafed, pseudoephedrine, and then the other one, which is, it just blanked out of my mind. I want to call it diphenhydramine, but that's Benadryl. It'll come back to me. So we talked about the Sudafed, that cold medicine, and how it was on the shelves, even though it was approved. Phenylephrine, that's what it's called. It was approved by the FDA a long time ago, and it's been shown that it doesn't really work at all, but it's still being sold as an alternative to pseudoephedrine. And why? So we've talked about this before.
Yeah.
But I kind of want to do a little bit more of a deep dive on something else we've mentioned before called thalidomide. And that was a request that I had for my students to talk more about that. And I just think it's always a good opportunity to explore the nuance of, okay, I have a whole lot of degrees in chemistry, and sometimes I still am not sure what to think about things. And here's my educated, best guess, basically, based on my education level and whatever. I'm using all that to inform these opinions. But even I'm still not sure. And so then, then thinking about someone like Jam who does not have any background formally in chemistry. Now he has like 6 years of this podcast.
Yeah, now I have a lot of informal.
Yeah. But, you know, so then how are you processing all this information? So how can I then equip people who maybe don't have the same background the best I can and like address some of these concerns?
Right. Yeah.
So great question, Castle. And I will say this is a hard question for me to navigate. Just the idea of, can we trust the FDA or not? And I would say the opinions of chemists on that one, I'm like, well, the relationship of chemists with the FDA, I can't speak as much to that because I'm not a chemist who's making things that are being approved by the FDA right now.
Right.
But what I can say is that I can give my thoughts and opinions on things that I have seen from the FDA. And I think there's a lot of fear mongering people who are like saying really absurd things like, oh gosh, red dye is made from petroleum. It's like everything is basically made from petroleum because it's building blocks of carbon. So that's like kind of a silly thing to be afraid of, you know, or, oh, this is just basically the same one carbon group away from gasoline. And you're like, yeah, everything kind of is, you know,
right.
where that is like a lot of fear mongery stuff. And so it's how can we really clarify what things are safe to consume and what are not?
Yeah. Okay.
So for me personally, I trust what the FDA says is bad. If the FDA says it's bad, it's definitely bad.
Right. So you're saying they wouldn't say something's bad if they didn't have evidence that it was. If they hadn't, if that hadn't been uncovered at some point in their research.
Absolutely.
Got it. Okay.
But on the other side, sometimes the FDA doesn't have enough evidence to say something is bad yet.
Right.
When it might be.
Got it.
And so that is where I think the gray area that's more nuanced come in. There are things that it's hard to say, you know, with these longer term effects, long-term impacts of especially something like food additives. I'm thinking more about food additives than medicines. Medicines are typically, I think they go through a very rigorous process with a lot of trials, and they're going to have less of a broad reaching impact than food additives because there's like only specific demographics are taking certain medicines, whereas, you know, everyone's eating food. So
yeah, everybody does like food, don't they?
Everybody pretty much, I mean, eats, right?
I didn't really notice that. It's like some people, you know, take medicine, but everybody's pretty into food. Yeah.
Well, and another thing I'll say is short-term impacts of a lot of things are pretty clear, pretty fast.
Right.
But if, you know, there's a new food additive that came out in the last, let's say 100 years, we're just now learning what the, you know, 50, 60 year impacts are of a global group of people consuming that every day.
Right.
So that's the gray area for me with the FDA, that it's like, it's doing its best. Definitely a lot of medicines go through a very rigorous process, and I have a lot less fear around things like vaccines, medicines. Those to me are like the mechanisms behind them are pretty well understood. They're very well studied. There's very rigorous trials for medicines to be approved. But with things like food additives and supplements that have less oversight regulation, and they're often approved for, there's no short-term clear effects. But what are the long-term effects that we don't know yet? And PFAS is a great example of that. It's like, oh yeah, we thought this was fine to use to coat food containers. And now it's like, we don't think it's fine anymore.
Yeah.
And so what are we doing? You know?
Yeah.
So I think
it's like, if you don't include the fact that there was that like waste from that one factory that had all this harm.
Right.
That was the byproduct or whatever.
Yes.
It's like the actual substance itself, there was no reason to think it was bad day one.
Right.
Or, you know,
or even day 365.
Yeah. Yeah. Right.
So I think those are things that's the only area where I'm like, oh, this makes it a little bit harder. And the other thing is it's a government agency.
Right.
And every government agency it's like manned by human beings.
Mm-hmm.
It's limited by funds and resources. And that kind of makes things hard. And so I kind of want to tell a story that I think represents that really well. And this is the story of thalidomide, which I've talked about before, but really of the woman who made it so that thalidomide wasn't used in the United States.
Got it. Nice.
So it's story time. So you can settle in, get your blankie, get a snack.
I wish I hadn't almost finished my tea already, but it's okay. Also, it's crazy because we have talked about thalidomide a lot, but never directly. It's been like on our way to something else.
Yeah.
So this would be kind of helpful, especially for people who've never heard about it at all.
Yeah.
But,
and there is a little mini chemistry lesson in there, which is that there are right and left-handed molecules, basically. Jim already knew. He raised his hand. He was like right and left-handed molecules. And they often interact with our bodies in different ways because there are certain like enzymes or receptor sites or whatever that are, it's like a left-handed glove for a left-handed molecule or a right-handed glove for a right-handed molecule. So if you have the left-handed one, it does one thing. If you have the right-handed one, it might do a different thing. And for thalidomide, it worked really well as a morning sickness medication to like one hand of it to suppress morning sickness for women who are pregnant. But the other hand caused birth defects. And while one hand was sold, only like one, left hand or right hand, whatever, was sold in the pill form, in our bodies, it was able to interact with other things and make it to where it could suddenly magically morph. It's not really magic, it's science. From only being the one hand to being a 50-50 mixture of the two. And so then there are suddenly babies being born in mass with birth defects that weren't really seen. Mm-hmm. And that happened across Europe, but not in the United States. And the reason that did not happen in the United States is because of one woman, Frances Kelsey. And Frances Kelsey, I mentioned her in last week's episode. Frances is a man or a woman's name.
Uh-huh.
And Frances Kelsey got a good education in a graduate lab with a man who typically did not hire women. And her acceptance letter was addressed to Mr. Frances Kelsey. So there is suspicion that Frances Kelsey only got to do all the things she did because someone thought she was a man. Okay. And that is a great example of how women in science could have contributed if we were allowed to.
This is very like random, but as you said, Mr. Frances Kelsey, I was reminded of, did you ever watch Arrested Development?
No.
There's this mysterious person I think it's the third season, named Mr. F. Mm-hmm. But then he's trying to figure out who this actually is, what the full name is and stuff. Mm-hmm. But every time he comes across something that says that on there, this little like jingle kind of happens, mm-hmm. like
mysterious music.
Non-diegetic. Like he's not hearing it, just we are. Mm-hmm. It's just like Mr. F. And it's like kind of like this like mysterious like ooh, like another little hint has been found, which made me think of that. It's like whoa, Mr. F, Mr. Francis. It's like. Actually, Mrs.
The mystery is deeper than you even know. Yeah. So that's a little tidbit about Mrs. Frances Kelsey. Actually, I think she was married. Yeah. Because her husband had a little bit to do with this. But so she, in the 1960s, was just beginning her job as a medical reviewer at the FDA. And I will say in the 1960s, being a medical reviewer at the FDA, the requirements were much less rigorous. So this, I do not think that this would be capable of happening today because the short-term effects are so obvious. Mm-hmm. This is not the kind of thing that the FDA misses anymore because of this case.
Got it.
The FDA, I think more so, not medicine, food additives, long-term effects are the question marks for me. This kind of thing, I feel pretty confident would not happen anymore.
Okay. Good to know.
Okay, but in the 1960s, the requirements were much less rigorous. Mm-hmm. And it was essentially just her and two other people, and they were often overworked and backlogged. Mm-hmm. But as she was new, this was only the second case that landed on her desk.
Whoa.
And she felt like, okay, this evidence is just not up to muster. And she was able to spend more time looking at it because she wasn't backlogged yet. And this is a quote from the Smithsonian Magazine. from an interview with her. She only died in like 2015. So
wow.
There's like actual modern interviews with her, which I think is really fun. On the internet interviews, Chemists reviewed the chemical makeup of the drug and how the manufacturer could guarantee its consistency. So like the consistency of the structure. While pharmacologists, so that'd be somebody like, this is my own aside, by the way, that'd be somebody like Claire. She studies, pharmacology. How does the medicine interact with the body? So pharmacologists then reviewed animal trials showing that the drug was safe. Though this appears to be rigorous and thorough process of checks and balances, Kelsey admitted to some weaknesses in her memoir, including the fact that many of the medical reviewers were part-time, underpaid, and sympathetic to the pharmaceutical industry. Yikes. The most troubling deficiency in the process was the 60-day window for approving or rejecting drugs. If the 60th day passed, the drug would automatically go to market.
Oh my gosh.
She recalls that this happened at least once, which is crazy.
Gosh.
So that wouldn't happen anymore. That doesn't exist anymore. That clause isn't there anymore.
That's so crazy. Just think of that, like, what if I just kept submitting drugs and just was seeing, when can I maybe do this? Where there'll be too backlogged to get to it. It's just
exactly.
It just 60 days does not seem that long.
No, it's not. 60 days for me, it's like 60 days, just thinking about my semester where I'm like really busy, super backlogged because I didn't have prep time, when I first started, is like 60 days goes by like that.
Yeah.
Like we're already in February 2025.
Yep. We're already like 42 days into the new year.
By the time this comes out, I think we'll be like even closer to 50 or maybe at 60.
Yeah.
Wouldn't that be crazy if this came out on the 60th day of the year? Or that'd be crazy.
That would be.
Anyway, just a little aside.
Wow.
Okay, so when she was given the case of thalidomide, she felt like there was something suspicious about it. And she had a pretty good background because her graduate advisor, the one who didn't want to hire her if she was a woman, allegedly, had worked with the FDA also. And so she found that there was no negatives at all. And she was like, this is just not normal. And so she started to say, oh, no, I don't think so. And they kept resubmitting it. And there was some lobbying or like campaigning for certain drugs to the FDA at that time. I don't know if that's still common practice. One of the interviews I cited in my resources, she talks about that. But this was excessive. Like too many, too much. You're pushing too hard for this. And it was great that she kept rejecting him because information started to come out that it was linked, not just, there was several other things I think that like had to do with blood pressure. And there were some early warning signs that they just didn't even report in their applications.
Wow.
And then the stuff with birth defects started to come out, en masse. And just by 1962, she was given awards and recognized as like, oh, you were someone who really made a big difference by your job at the FDA. And so after this amendment, Congress passed the Kefauver-Harris Amendment, which required more oversight of clinical studies, including, so we have to do something, and even though I don't do medical studies, I have to go through training for this. Any research on human subjects, you have to get informed consent. So you have to tell them what you're studying on them, and you have to give them all the information, and they have to consent to like anything that could happen. And then there's a much more thorough scientific review and more scientific evidence of the drug's effectiveness, not just safety, but does it really work? And I mean, like, there's like phase 1 trials and then phase 2 trials. So there's like really a lot of steps to get drugs approved now by the FDA. So like I said, this would not happen now.
Yeah.
But at the time, it was possible, and she was like the reason. Just this one person, her husband also, I don't exactly remember his role. I prepped this a little bit ahead of time, but he also did something in the field, and she brought it to him, and he reviewed it and was kind of like, yeah, this also seems suspicious to me.
Yeah.
So there's a little bit of collaboration. It wasn't just her, but she was the one who flagged it and really stopped it.
Right. And it took somebody to do that in the first place to even have a chance, right? So
yes,
at that point, at least.
Absolutely. And, this is a huge win for the US FDA. But it's also just like a win because one person really cared about their job and they weren't stressed out yet and they weren't backlogged yet. And so I guess I feel like it is a win, but it also is a really good showcase of like the government is kind of dependent on its weaknesses. Like there's like the best case scenario of how they operate, but then there's also the worst case scenario. And in the worst case scenario, we're only as good as the laws that we have in place. You know, it's like that 60-day law and then having like not enough people hired, not enough resources to manage all this. And like if she had been in that job for a year, she might not have even had time to process through this before it got through, you know? And so that again, you know, brings back the impact that these laws can have, but also how important it is to have government agencies that are well funded.
Yeah.
But I also think it shows like, okay, even in the best case scenario, governments are run by individuals. So even the FDA now is made up of individuals who have done a lot of checks and balances to make sure, you know, they're for the most part a good faith organization. They're trying to do their best, but they're also only human.
Yeah.
And they can only do their best with the information they have right now.
Yeah.
And they have done a lot to get a really rigorous approval process. And, you know, like I said, like drugs now are in a great situation, but there are these gray areas of things that are much longer term impacts that it's not really possible, realistic, or even ethical, I think, to study like, though this, you know, food additive could do this really, I guess I think of it more in terms of drugs. Like this one drug could do an amazing thing and save a lot of lives, but will it hurt people's lives in 100 years? We have to do a 100-year trial before we can know. You know, it's like, at what point are we losing out on human life for fear of ramifications that we can't even see?
Right.
You know?
Yeah. It's like, and it's the hard thing of like, you can prove the short-term negatives of something. You can't prove something is completely devoid of any negative though. It's like one of those difficult things that about anything. It's like you can't really prove the absence of something definitively.
Right.
You can't say there is nothing bad in this.
Right.
But you can at least do the like, well, there's nothing we can find in these situations that showed a negative in this amount of time.
Yes.
But it's just like be an impossible task for any agency or whatever to be like, make sure there's nothing bad in here, and only when you've proven there's no chance, then we'll approve it. It's like, okay,
and that's
great.
not possible. Yeah, you can't do that.
Yeah.
And like I said, I have a lot of insight into what are the requirements to get medicines approved because I have to go through the same initial training. They have a lot more training, but my initial training for human subjects research is the same. But I have no idea what the approval process is for food additives.
Yeah.
And we know that supplements aren't regulated in the way that food is regulated. And so there's a lot of question marks for me in those areas. And those are the things I think that could have the longer term negative ramifications because they're so widespread. So for me, just to sum up what I have here with the FDA, I think for the most part, they're a good faith organization. I think human beings are involved, so nothing's perfect.
Right.
And there are some weaknesses that I can see in their current system. Not as glaring as the 60-day rule, but that it's just hard to overcome some of those weaknesses. And so for the most part, for me, I feel very safe with FDA-approved medicines. And I feel very safe with anything that the FDA is like, don't do it. I'm like, they probably have good evidence for that. I'm not going to do it.
Right.
But there are some gray areas of things that I'm like, we just don't super know, you know, like how drinking calorie-free sweeteners is going to impact us. And as soon as they find out something for sure, like there was one really early on, I can't remember the name of it.
Yeah.
Not aspartame. Was it aspartame?
No, because that one's still out there. Was it saccharin?
Maybe.
Okay. Yeah.
I don't remember.
I know you're talking about.
Yeah. Sucralose, maybe? No. There was one that very quickly it was like, oh, this does cause cancer. Actually, let's roll it back.
Yeah.
And they did very quickly. It's not on the shelves anymore. But so it's just things like that that we're like, there's some gray areas that I have more questions about. And we'll get into some of those next week when we talk about the recently banned red food dye.
Okay, cool. Interesting. Cliffhanger.
That's our little cliffhanger.
Nice. I was going to add one thing that the reason I ever even had heard about thalidomide a long time ago, that I think I mentioned this to you a while ago too, but it might have been one of the first times it came up, is there's this very famous song. Actually, Mason, when you look up who it's by,
spoiler alert, Mason's right over here.
Yeah.
Came in partway through this episode.
Jamie, will you pull up that?
Yeah, what if he's our producer?
Yeah.
We're like, could you get the links to those articles for me?
It's called "We Didn't Start the Fire."
Oh, yes.
And that group, whatever, just lists a ton of things that Billy Joel. Yeah, that's what my gut was telling me, but I was like, I'm not fully confident.
That happens to be on this show so many times.
Yeah, and I'm getting a Billy Joel. Okay, this just in, and one of my history teachers went through that song and talked about each one of those events that's going on, because it's literally just like basically a list of events
that they were like, it wasn't our fault that all this is going wrong.
Right.
Sometimes I want to do that for the fact that I can't buy a house.
Yeah, it's just and I think its relevance today is still this like level of like, oh well, we didn't start the fire; it was already burning, and maybe we didn't do a great job of trying to fix it and put it out, but we didn't start it. It's like, there was a lot that we inherited here.
Yep.
And I wonder if Billy Joel was, getting some pushback from, I don't know what point in his career he was writing this song, but I wonder if like the younger generation was, complaining about a lot of stuff. And he's like, I get it. Okay. I get it.
It's already been burning since the world been turning.
Yeah. We had the same feeling whenever we came into our own as the adults of the world or whatever.
But as a history teacher, isn't that fun? Like, that's kind of a fun thing to get to
totally.
do. Let's talk about every one of these.
Yeah, and like I remember it. You know what I mean? It's like I made that's obviously like a very memorable story, Thalidomide. But if it wasn't a lyric in a song and talked about in that way, would I have remembered it as well? I don't know if I would have. But anyway, that was that every time we talk about this and it comes up, I hear that exact lyric, the children of thalidomide.
That's funny.
Which is kind of funny because it's like it's such a tragedy, and then it's like the song's kind of it's not like peppy, it's not like happy. It is, but it is a little.
It's like upbeat sounding.
Yeah,
if you didn't know what the words
tempo.
were, you'd be like, "Oh yeah, this is fun," and then you're like, "Oh, these are intense."
Yeah, these things sound bad. Yeah. Well, thanks for teaching us about this and leaving us on a cliffhanger.
Yeah.
About it.
Kind of fun. Little cliffhanger.
Yeah, I like it. And if you have questions about FDA, about other chemistry related things, ideas for episodes, you can reach out to us on our website at chemforyourlife.com. That's chem, F-O-R, yourlife.com to share your thoughts, ideas, and questions and follow-ups. If you'd like to help us keep our show going and contribute to the cover cost of making it, you can join our super cool Chem community of patrons on patreon.com/chemforyourlife. It's patreon.com/chemforyourlife. You get ad-free feed of the show. You get behind-the-scenes stuff. You get some exclusive things depending on which tier you pick, like a digital virtual coffee hour with Melissa and I. A bunch of cool stuff, ways of us saying thank you for helping to keep the show going, helping it exist in the first place, and keeping it free for everybody else. But if you're not able to do that, even though it'd be awesome if you did, you can still help us by subscribing to your favorite podcast app, rating, write a review on Apple Podcasts and Spotify, and subscribing on YouTube, leaving a comment over there saying, hey, those things help us to share chemistry with even more people, help more people find our show, and help the chemistry of their everyday life be explained to them.
Absolutely. This episode was made possible. This episode of Chemistry for Your Life was created by me, Melissa Collini, and him, Jim Robinson. I just did the nope thing that Tim, our community member, messaged about. So shout out Kim. I said shout out Kim.
Shout out Chem Community Tim.
Community Tim. Chem teacher Tim. Sorry. And also Jam is our producer. And the show is made possible by our community members. And we are so, so grateful for every one of you. And so we want to thank Venus R, Suzanne P, Sarah M, Christina G, Julie S, Jeanette N, Jacob T, Erica B, Emerson W, Colin R, Sierra L, Chelsea B, Avishai B, Autoclave, Rachel R., Latila, Jesse R., John T., Heather R., Elizabeth P., Dorian V., Chelsea M., Brian K., Timothy P., Stephen B., Scott B., Lynn S., Katrina B., Hunter R., and Chris and Claire S. Thank you. We love you.
Do we have references for this one?
Yes.
If you'd like to learn more about today's chemistry lesson and FDA and thalidomide and all that kind of stuff, you can check out the references for this episode in our show notes or in the description of the video on YouTube.
Yay, chemistry!
Yay, chemistry!